The Childhood Obesity Initiative has two primary goals, which are to increase access to healthy foods and to increase opportunities for safe physical activity in all neighborhoods throughout San Diego County. To do this work, we engage partners across multiple sectors, including government, healthcare, schools, early childhood, community, media, and business to work together in new and different ways to achieve our goals. Early on, bringing partners together for the first time, having them help us achieve a common goal and common vision. There were issues of trust. People had never worked together before. They didn't really know each other. They didn't perhaps totally understand our concept. And there were issues related to recognition of partners, fundraising, a concern that us as the backbone organization were somehow going to compete for funding with our partners. These are all issues that have worked out over time, and as we've seen levels of value in participation in our initiative, as well as higher levels of trust develop, these are issues that we've, for the most part, overcome. Our role as the backbone leader for the Childhood Obesity Initiative takes many forms. Initially, our most important role was really to bring together partners to help us create our common goals and our common agenda. That work was important, and bringing those partners together to be part of that process really helped not only to build support for our efforts, but also to help create ownership in our action plan, which has continued over the years. We bring people to the table. We are conveners, we're facilitators, we are champions for the work, we guide and direct efforts. We are resource managers, both in terms of finding funding to support our work as a backbone, but also helping our community partners find work to support the work that they're doing. We are communication managers, problem solvers. At the end of the day, the most important thing we do is build relationships, because everything gets down to that. If you build relationships that are meaningful and impactful and long-lasting over time, people are going to come to your table, they're going to stay at your table, and they're going to be there for the right reasons. Our advice to other communities is to not rush into collective impact. I think it's important to take your time to build the right partnerships, to make sure that you have an organization serving as the backbone who's experienced and knowledgeable. And I also would recommend looking at what other communities have done to determine the right approach and methods based on your partners, your issue area, and what makes sense for you in your community. We have seen many policy and environmental changes in 8 years, working toward our goals of improving access to healthy food and opportunities for physical activity in all neighborhoods in San Diego County. We've seen everything from changes in municipal policies that help support community gardens, to school districts embracing farm-to-school programs, which serve not only to improve the foods that are offered to kids in school, but also help to support our local economy and local farmers. And we've also seen community residents really step up and advocate for changes in their communities, everything from improving their parks to creating a healthier transportation system throughout our county. Perhaps the most important impact we've achieved is between 2005 and 2010, we saw a reduction of nearly 4% in the rates of childhood obesity in San Diego County. And this was during a time when other counties in California either saw a lesser decrease or in some cases an actual increase during that same time period. Collective impact is really the only way that we would be able to make the achievements that we've made. Bringing together partners from different sectors, encouraging them to work toward common goals and a common vision, helping them understand how the work that they do, which is unique, fits into how the work everyone else does and how it supports this common vision, doing what they do best, but doing so in coordination and collaboration with others. That's really the only way that you're going to make systemic change the way that we want to see with the Childhood Obesity Initiative.